Have you noticed yourself waking up multiple times a night just to use the bathroom? Maybe two, three, or even more interruptions? Most people think this is simply an unavoidable part of getting older, but in reality, your body is trying to tell you something important, specifically your prostate. There's a conversation about prostate health that should take place in every doctor's office once you reach your 60s, yet it rarely happens. And no, it's not about increasing medications or scheduling uncomfortable procedures. It's about understanding three surprisingly simple daily routines that can dramatically transform how your prostate functions. These habits are backed by scientific research and in many cases work even better than expensive treatments. Yet most men have never heard of them. My name is Jane, and after more than 2 decades working as a urologist, I've spoken with thousands of men who struggle silently with prostate issues. Today, I'm here to explain the truth in a clear, practical way. And the third habit might be something you've never considered before. Before we get to the habits, you need a quick understanding of why this gland causes so many issues as we age. Picture the prostate as a small, walnut-shaped gland that sits right below your bladder. What matters most is that it wraps around your urethra, the tube your urine passes through. As men get older, hormonal changes cause this gland to gradually enlarge, and because it surrounds that narrow tube, even slight growth begins to compress it, similar to stepping on a garden hose. This is why urinary symptoms become so common. By age 60, over half of men experience problems such as difficulty starting urination, a weakened flow, feeling like the bladder never fully empties, or constant nighttime trips to the bathroom. And by age 70, around 70% of men deal with these issues daily. Here's the part most men never question. They assume this is just normal aging. But the truth is that you do not have to accept these symptoms as inevitable. Science now confirms that certain lifestyle habits can not only slow prostate enlargement, but also help reverse some of the underlying irritation and inflammation that makes symptoms worse. Let's begin with the first habit, something extremely simple, but often misunderstood. Habit number 1, smart hydration. Yes, drinking water matters, but the secret isn't the amount, it's the timing. When your daily water intake is too low, your urine becomes highly concentrated, filled with irritants that aggravate both the bladder and the prostate. This leads to inflammation and worsens all common symptoms. The trick is to drink most of your water earlier in the day, morning through late afternoon. After around 6 p.m., reduce your intake significantly, taking only occasional small sips if needed. This keeps the urinary system well balanced during the day while allowing your bladder to stay calmer at night. Men who follow this timing strategy report up to a 40% reduction in nighttime bathroom visits, leading to deeper, more restorative sleep. It's a simple change, but incredibly powerful. Now let's move to the second habit, which most men overlook but can be started right away. Now that hydration is clear, let's move to a surprisingly effective daily practice that works through a different mechanism, one that directly affects inflammation levels throughout your entire body. Habit number 2, the post-meal walk. This one is deceptively simple. All you need is a gentle 10 to 15-minute walk right after your main meals. You don't need speed, intensity, or sweat. A relaxed stroll is enough, but the science behind it is remarkable. Every time you eat, your blood sugar rises. A short walk immediately afterward helps your muscles absorb that glucose as energy, preventing the usual blood sugar spike. Research published in Diabetes Care found that 3 short walks after meals are more effective at controlling blood sugar throughout the day than a single long workout. Why does blood sugar matter for the prostate? Because frequent spikes contribute to chronic inflammation, and chronic inflammation is one of the most significant contributors to prostate enlargement and discomfort. By adopting this simple habit, you directly reduce inflammatory stress on the prostate. A slow walk around your neighborhood after lunch or dinner can create enormous long-term benefits, not just for prostate health, but for overall metabolic function too. Now it's time to address the third habit, one that tends to make men uncomfortable, but is strongly supported by science. Habit number 3, natural prostate cleansing. This habit refers to maintaining regular ejaculation for prostate health. A well-known study from Harvard University followed more than 30,000 men for almost 2 decades. The results were striking. Men who ejaculated roughly 21 times per month had up to a 33% lower risk of developing prostate cancer. Why does this happen? Because ejaculation acts like a cleansing mechanism for the prostate gland. It helps release old fluids, cellular debris, and potential irritants that can accumulate and lead to inflammation over time. The study found the benefits applied whether ejaculation occurred with a partner or through masturbation. What mattered was consistency. For many men without a regular partner, this topic may feel awkward, but from a medical perspective, it is completely normal and beneficial. If this makes you uncomfortable, speaking openly with your doctor may help. Prostate health should never be a taboo subject. A critical reminder: these 3 habits form a strong foundation, but they do not replace medical checkups. If you're over 60, yearly exams, including PSA testing and digital rectal exams, are essential. Early detection is the strongest protection you have for long-term health. I've seen countless patients adopt these steps and report incredible improvements. But for men struggling with more advanced symptoms, frequent dribbling, urgency, or severe nighttime interruptions, addressing inflammation more directly can speed results. That's why I often recommend a simple 15-second nightly ritual that many men find effective for reducing swelling and easing symptoms within weeks. It's natural and avoids the side effects of harsh medications. I've created a short presentation explaining exactly how it works. The link is in the pinned comment and in the description. If any of these habits surprised you, or if you're ready to try one today, share your thoughts in the comments. I personally read as many as I can, and don't forget to like, subscribe, and share this information. It may truly improve someone's life.